Most people spend 50 years paying into a system they don't fully understand. Today, we're changing that with Daniel Olofsson from LifeSmart Senior Services. For 16 years, Daniel has specialized in cutting through the Medicare maze to match families and plans that actually fit their specific doctors and prescription. He works alongside your existing financial advisors and family to ensure you're maximizing every benefit you've earned. I'd like to welcome Dan Olofsson to the Give a Care podcast. Hi, Dan. How are you today?
I'm doing great. How are you?
I'm fantastic. Thank you so much for joining us. I really wanted to do this with you because we know we have the Medicare enrollment coming up soon. And with you being a Medicare expert, it's important that people understand why they need to sign up for Medicare, how early they need to sign up for Medicare, and all the pros and cons about Medicare. So once again, thank you for joining me.
My pleasure. Thanks for inviting me.
You're very welcome. So I haven't seen you in a bit, so it's good to see you. Well, not, virtually, of course.
It's good to see you.
It's been a while.
Yes,
How's the gang doing?
it's growing. There's still more
Really?
people. The new location is working out well.
Really? Okay.
Yeah.
I had some questions about that. I wasn't sure how that was going to work out.
It's so far, knock on wood,
Okay.
it's been working well.
Well, I'll be back soon. As you know, I am here in Belize and, don't mind the background, of course, but I'm having a fantastic time and getting ready to come back to the US in about a week or so.
I need to come down to Belize and check it out.
Come on
It's
down.
30 degrees. It's 30 degrees here in Chicago.
And I'm sweating right now where I'm at. So it might not look like it, but I'm sweating.
I would love to be running on the beach.
Yes, and it is nice. It is beautiful. So we're going to dig in and talk about Medicare and why it's so important for, folks to sign up when the time is right. So tell me, why is Medicare so famously stressful for families? And is it actually as complicated as it feels when the mail start rolling in?
Well, get too worried about how Medicare works. People should talk to someone who is licensed and certified who can explain how the system works. It's really very simple
Uh-huh.
once you understand how it works, but it's complicated in that everyone makes it more complicated. Should I
Okay.
take this? Should I take that? Should I be involved with this? What does my aunt have? What does my uncle have? And typically, the people who they rely upon for advice have done the wrong thing. So they're giving wrong advice. It's
Okay.
really very simple once you boil it down.
Okay. So you're a licensed professional,
Yes,
and
I
how
am
long
a
have you been licensed?
I am a broker. I
Okay.
represent 20 plus different insurance carriers.
Huh.
I've been doing Medicare for about 16 years.
Okay. It's a long
So
time.
I've seen just about every situation that you can imagine, good
Uh-huh.
and bad, and I've walked people through things. Believe it or not, this is going to come as a shock. Our Social Security department, our Medicare department will make mistakes.
Mm-hmm.
But the good thing is they will correct those mistakes once it's brought to their attention.
Okay.
People just need someone who can walk them through the way the system is supposed to work so they know what to expect.
Yeah. And I know that you made it easy for my mom when she was getting ready to turn 65. It's not as complicated as people make it out to be. It was a very easy process, and I really appreciate that you were able to get her through that because my mom is a worrywart, and she wanted to make sure that she was doing this at the right time and making sure that she picked the right company or insurance company for her. So thank you for that.
My pleasure. And your mother's a perfect example. People who will worry about it, they
Mm-hmm.
will let their worry turn into inaction, which then
Yeah.
causes more worry and more stress. And you don't have to.
Yeah.
Honestly, it is the best medical insurance I've ever had in my life. Believe it or not,
Okay.
I'm on Medicare. Believe it or not, I'm on Medicare.
I can't believe it, Dan. I can't believe it.
I'm the only 49-year-old who's not disabled who's on Medicare.
So, what happens when people get all this stuff in the mail? It can be so confusing because I saw it with my mom getting all these postcards and letters in the mail about Medicare. What should they do when they get all this junk in the mail?
If they have a fireplace, they should if they have a fireplace, they should use it for kindling because it will turn into very good kindling. It will start some good fires. They can look at the stuff that they're receiving, but don't take it for gospel.
Okay.
I like to give the example that if I was selling bananas and all I had to sell were bananas, I would
Mhm.
not tell you how good apples were.
Yeah.
So
Yeah.
the stuff that they receive in the mail is only talking about their one program. So
Okay.
people will get confused as to which program is best for them or why they should
Mhm.
go with one insurance company as opposed to another.
Yeah.
Most of that mail is single focused on one company or one type of
Okay.
product.
Okay. So I know that there's so many different parts to Medicare. So can you explain the alphabet soup, the parts A, the B, C, and D in plain English, as we know what they actually cover? And I know that it's a lot because I've heard you before explain all the different letters and what they cover, and it can be very lengthy. So I'm going to say this to our audience immediately. We're going to have Dan on for quite some time because there's so much to understand about Medicare and all the different parts that it's associated with. So Dan, can you explain the alphabet soup parts A, B, C, D? And I think there's E also, isn't there?
I sing the alphabet song now like I did with my grandkids. Part A, let me tell you how simple this is. Part A, now think of it as a separate box. So in
Okay.
one box is your Medicare. One part of your medical insurance is in a Medicare box. Part A, it covers your hospital bills. So if you go to the hospital, Part A covers your hospital.
Okay.
There is a deductible. That deductible is increasing this year, but you have to pay the deductible. And
Mm-hmm.
then there's Part B. B as in boy. B as in boy covers the doctor. Part B pays 80% of the doctor's bill. There is no cap. You
Mm-hmm.
pay the other 20%.
Okay.
So if you have Medicare and you get a physician's bill for $100, Medicare pays $80, you pay $20.
Okay.
What's more likely is if you get a bill for $100,000, Medicare pays $80,000, you pay $20,000.
Okay.
That's all you get with Medicare.
Mm-hmm.
We worked 50 years paying into Social Security, and they cover hospital and doctor. And for the privilege of getting your doctor covered, you get to
Mm-hmm.
pay monthly. It was $185 a month. It is now going up to $202 unless you make too much money.
Okay.
If you make over certain sums, you get to pay more money. But let's just say you're making under $105,000 a year.
Mm-hmm.
You're paying $202 a month for Medicare every month.
Okay.
Unless you're on Medicaid, and then Medicaid will pay that, but that's a whole different area.
Yeah, that's a whole different story. So, uh,
A and
did
B,
we talk about D?
not yet. Part C are the Medicare Advantage plans.
Okay.
There's two type of Medicare Advantage plans. One is a PPO. Well, there's actually four, but for general terms, it's typically two. There's PPOs
Okay.
and HMOs. You go to a separate insurance company to get those. You do not get those from the federal government. And there's
Okay.
Part D, as in dog, David. Part D covers your prescriptions. Excuse me. Now, the interesting thing about Part D is you have to have coverage. If you do not have Part D coverage when you're first eligible, you are
Mhm.
penalized for life.
Okay.
So you have to have prescription coverage even if you do not take any prescriptions.
Really?
Even if you're healthy as a horse, you have to have Part D, or you're penalized when you sign up.
So can you sign up? Let's just say you sign up for Medicare and when you turn 65 or 64 and a half, and you decide that you don't want to sign on for Part D because you're not on any drugs or prescription medication and you fall ill, can you go back and sign up for Part D?
As long as you sign up during during an enrollment period.
Okay. And what's the enrollment period?
The enrollment periods vary. When
Mm-hmm.
you first turn 65, you can sign up 3 months before your 65th birthday, the
Mm-hmm.
month of your 65th birthday, and 3 months after.
Okay.
If you miss that enrollment period, you're out of luck until the next annual enrollment period,
And when is that?
October 15th through December 7th,
Okay.
as long as you've signed up for Part B. If you haven't signed up for Part B or Medicare, then you have to wait until the following January to
Mm-hmm.
sign up. So I encourage people to sign up as soon as they can, 3
Mm-hmm.
months before you're turning 65.
Mm-hmm.
Get A and B, unless you're working and have comparable coverage, get A and
Mm-hmm.
B, and also get Part D. There are numerous plans available that cover prescriptions at zero cost.
Okay.
And I can't talk about specific carriers, but there's numerous carriers
Mm-hmm.
and it's a zero charge. So why not sign up and avoid the penalty?
Yeah, no, I agree with you wholeheartedly. So is there any part of the alphabet soup we missed or I missed to mention?
But that is the parts, that's with the federal government. We haven't talked about plans. Plans are a
Okay.
whole different area.
Most people pay into Medicare for 50 years but have no idea how it actually works. That's why we're talking to Daniel Olofsson of LifeSmart Senior Services. With 16 years of experience, Daniel and his team match your specific doctors and prescriptions to the best possible plans, whether it's Medicare, the alphabet soup, or the supplements. His goal is to maximize the benefits you've earned at no cost. Stay ahead of the curve with our community resources. Join our free newsletter, get expert takeaways and action steps delivered straight to your inbox. Connect with me. We're moving our community to Facebook, so follow us on Facebook, Instagram, and TikTok for the announcements. All the links are in the show notes. Remember, I see you and you're not alone. Now let's get back to the interview. Okay, so we'll get to plans in a second. So one of the biggest question is if I switch my plan, can I keep my current doctor? How do these different plans affect which hospitals or specialists can be used? So explain what a plan is for most people who wouldn't understand if they're just signing on for Medicare.
You're just signing on for Medicare. You can decide to go one of two routes. If you take one route, I like to tell people, look at your left hand. If you take the route on your left side, you can take a supplement. With a supplement, you can take different plans. Plan F is no longer available. Plan G is the one that's most commonly taken, or a Plan N. Everything depends on your appetite for paying for the plan. Depends on your budget. If you don't want to go the supplement route and want to go the Advantage plan route, it's then up to the agent to look at your doctors, look at your prescriptions, and put you in the best plan for you.
Okay,
I
so
want
what is the main difference for the patient for the Medicare Advantage or the supplement supplemental plan?
Medicare supplement will start at 65 at roughly $175 a month. A
Okay.
plan G is a plan G is a plan G. By that I mean it doesn't matter which company you pick,
Mm-hmm.
it's all going to pay the same. It's all going to take care of the doctors and the hospitals the same way. The only difference is going to be the price.
Okay.
The price varies considerably. So let's say it's an average cost of $175 a month. The Advantage plan will come as an HMO or a PPO.
Okay.
Depending on your doctors and the plan we pick, that will cost $0 per month, typically. Supplement will increase in price anywhere between 10 and 20% a year, every year for the rest of your life. An Advantage plan increases by 0 every year if you're in a 0 plan.
Okay. So what we see on the commercials on television for zero premium, as you mentioned, what is the catch or the trade-off for people who want to or need to watch out for? Do they need to watch out for anything, or is the
Yes.
zero? Okay, let's talk about that.
The first thing you have to watch out for is to make sure that your doctors are in network. You want to
Okay.
make sure that your primary care physician is in network, and you want to make sure that you can go to any doctor you want to go to should the need arise. You don't want to, a lot of the plans that you will see being advertised on TV offer give backs, offer money back, offer things which appear to be too good to be true because you're getting put into a program which is extremely restrictive.
Okay.
You can switch Advantage plans once a year. So if you get put into a restrictive plan, you can get out of it a year later. But what happens if you get sick?
Yeah.
The most important thing to me is making sure your doctors are covered, making sure your prescriptions are covered.
Yeah. There's a lot that I think goes with that, Dan, especially on the care side of things, when people a lot of times don't understand or even know whether or not it covers, long-term care or staying in nursing homes, which can be very confusing because then they'll say, oh, I thought that this covered, or they'll call and say, do you take Medicare? And then I'll have to tell them, no, we don't take Medicare. Does it cover long-term care? And does it cover nursing home stay?
Does not cover long-term care, depending on the plan. The thing that people should look at is the summary of benefits.
Okay.
Look at what the summary of benefits tells you is covered. Traditional Medicare does not cover long-term care. Some Advantage plans will cover short-term, and here's another curveball. There's also a thing called hospital indemnity. Client can get a hospital indemnity plan, which will pay any copays back to the client and could cover some short-term and or long-term care, but they're not going to cover long-term care for an extended period of time.
Okay. So if someone is still working at the age of 65 and has insurance through their job, which I think you mentioned a little earlier, how do they still sign on for Medicare right away?
What they should do is first talk to their HR department and make sure that their plan is comparable to what Medicare offers. Most insurance plans offered by companies are comparable to what Medicare offers. As long as it's creditable coverage, by that I mean it's as good or better, as long as it's creditable coverage, they don't have to sign up for Medicare right away. They should sign up for Part A.
Okay.
Part A is the hospital, and that just gets the ball rolling. They don't have to sign up for Part B because then they're paying double insurance, and insurance companies are not going to pay double.
Yeah.
Because people will do that, there are specific rules regarding who pays first and who pays what. If a company has more than 20 employees, the company's insurance is responsible to pay. If
Okay.
a company has less than 20 employees, Medicare pays first.
Okay.
But I advise people to talk to their HR department, see if they've got creditable coverage, and then make a decision as to whether to apply for Medicare or not.
Okay.
Typically, I have them only go with Part A.
Okay, that was going to be my question, because I heard you say earlier that they would need to sign up for Part D because that covers prescription. So if they're currently with their work insurance and they're turning 65, do they need to sign up for Part D or no?
No, as long as their employer covers prescriptions.
Okay.
So the employer's plan has to provide some type of prescription coverage, and then it's creditable coverage. But their
Okay.
HR department knows exactly what is, should know exactly what is and isn't.
So
Creditable, sorry to interrupt you, creditable coverage is not discount. Here, the union will give you a discount for your prescriptions. That's not creditable coverage. There has
okay.
to be insurance coverage.
Okay. So, and I'm just asking the questions because I want us to be clear to the audience. So would they be penalized then for not signing up at 65 for Part D? I have to ask the question because I heard you talk earlier about some penalties.
Yes. They have creditable coverage at the time they decide to retire and they decide to leave, or if their company takes away the insurance benefit, we then fill out a form that we submit to the federal government. The federal government has a form to apply for Part B and a form showing that you had creditable coverage, which is signed by your employer.
Okay.
They are not penalized then.
Okay.
If they do not have creditable coverage, they would be penalized.
Okay. Thank you for clearing that up, Dan.
So when you're turning 65, you just talk to HR.
Okay. Sounds easy enough. So tell us maybe 1 to 3 questions that either an adult child or a senior should ask about Medicare when they're trying to get signed on.
Are my doctors or parents doctors in this program? Do they have the freedom to see any doctor they want, or do they need a referral? How much are the out-of-pocket costs for copays? Is there any opportunity for giving us money back with our Social Security?
Okay.
Are the drugs covered? Are the drugs in the plan and in the formulary? That's really it. That's a good place to start.
How do you give a care, Dan?
Give a care because I educate people. I want them to know what they're doing. It's unfathomable that we work for 50 plus years. We pay into the system and we have no concept of what's available. I want to educate people. I would like everyone to sign up with me, but I could care less. I hope that doesn't sound arrogant, but I want them to know what they're signing up for. I want them to know what they're going to do, because an educated consumer can take care of themselves.
I agree.
Whereas somebody that just walks into an insurance office and says, I need Medicare, it's not good. When somebody says, I'm all set, they're not set.